This video is brought to you by Global Men's Wellness, your 24/7 AI health expert. No copays, waiting rooms, or awkward conversations. Just real answers whenever you need them. Visit globalmenswellness.com to try it free and get your own on-demand concierge-level wellness expert today. Welcome to the Global Men's Wellness Podcast. I'm Dr. Judson Brandeis, and I'm so glad you're here. Let's talk about a health threat that is as dangerous as it is overlooked: muscle-invasive bladder cancer, or MIBC. It's a condition that affects thousands of men every year, yet most don't hear about it until they or someone they love is already diagnosed. Bladder cancer is the sixth most common cancer in the United States, and muscle-invasive forms account for about 25% of all cases. This is not a surface-level issue. MIBC involves cancer growing into the muscular wall of the bladder, and once it gets that far, the risk of death skyrockets if left untreated. What is MIBC? Think of your bladder like a balloon. Normally, it stores urine and releases it at your command. But when cancer burrows into its muscular layer, that flexible, resilient organ becomes compromised. It's like a pipe corroding from the inside. Eventually, it leaks, weakens, and breaks. MIBC is not superficial. It's a deeper, more aggressive form of cancer. Unlike non-muscle invasive cancers that can often be managed with localized treatment, MIBC often requires the removal of the entire bladder. Yes, the entire organ. That alone is life-changing. How does it work? The cause of MIBC is multifactorial. The biggest culprit? Tobacco smoke. Still the number one risk factor for bladder cancer, accounting for about 50% of cases. Carcinogens from smoking are filtered by the kidneys and stored in the bladder, damaging the cells lining it. Over time, those cells mutate and invade deeper tissues. Other causes include workplace exposures to industrial chemicals, radiation, and chronic bladder inflammation. Genetic predispositions also play a role, although not as clearly defined. When cancer invades the muscle layer, it compromises the bladder's ability to function. Left untreated, it can spread to lymph nodes, bones, and vital organs. Is it new? Is it proven? MIBC isn't new, but how we manage it has evolved. In April 2024, the American Urological Association, AUA, ASCO, ASTRO, and SUO, released an updated guideline for treating MIBC. These guidelines emphasize evidence-based, risk-stratified treatment pathways using a multidisciplinary approach. Cisplatin-based chemotherapy before surgery, called neoadjuvant chemotherapy, is now the gold standard for eligible patients. Immunotherapies like nivolumab are also reshaping the landscape, particularly after surgery for high-risk cases. Why don't more people know about this? There are several reasons. Public awareness of bladder cancer is low, especially compared to prostate or testicular cancer. It doesn't get celebrity spokespeople. Its symptoms, like blood in the urine, are often ignored or misattributed to urinary tract infections. And let's be honest, bladder cancer isn't something men talk about over coffee. Insurance barriers, delays in diagnosis, and misinformation about treatment side effects only widen the gap. What do patients experience? Let's talk reality. For most patients, the journey starts with a procedure called TURBT, transurethral resection of the bladder tumor, to confirm diagnosis. Then comes staging scans, labs, consultations with surgeons, oncologists, and radiation specialists. Treatment options vary. Radical cystectomy, the surgical removal of the bladder, is often necessary. This is a major operation with significant lifestyle changes. Urinary diversions are required post-surgery, either an external bag, ileal conduit, an internal pouch, continent cutaneous diversion, or a neobladder made from your intestine. Bladder-sparing therapy is possible for select patients and involves combining surgery, chemo, and radiation. Recovery can be physically and emotionally demanding. Patients may face issues with sexual function, continence, and metabolic balance. But with proper counseling, support, and expert care, many adapt and thrive. Personalized urologic care. This is where the art of medicine meets the science. Not every man with MIBC is the same. Some are younger and active, others older, with multiple health issues. My role is to guide each patient through a decision tree shaped by his biology, lifestyle, and goals. Whether we're talking organ-sparing surgery, nerve-sparing approaches, or integrating regenerative therapies, precision matters. I work with nutritionists, oncologists, physical therapists, and mental health professionals to support every aspect of recovery. How effective is it? Data show that combining chemotherapy with surgery improves survival rates. In clinical trials, patients receiving neoadjuvant chemo followed by surgery lived longer than those who went straight to surgery. Bladder preservation, done properly, can also yield excellent outcomes. In some studies, 5-year survival rates approach 70% for select patients. The key is careful patient selection and ongoing monitoring. The future of urology. We're entering an exciting era in bladder cancer care. Here's what's coming: AI-assisted diagnostics to predict recurrence risk, genomic profiling to personalize chemotherapy and immunotherapy regimens, minimally invasive robotic surgery for faster recovery and fewer complications, telehealth follow-ups that make post-op care more accessible, bladder regeneration research using stem cells and tissue engineering. We are not far from a future where we can rebuild what cancer destroys. Why I do this work? As a urologist, I've seen how devastating MIBC can be, not just physically, but emotionally. I've also seen what's possible when men are empowered with the right information and the right care. I do this work to offer more than treatment. I offer options, hope, and a pathway back to vitality. Too many men suffer in silence. That ends here. If you're listening today and thinking, could this be me? Please ask your doctor. Don't wait. Early detection, thoughtful care, and innovation can make all the difference. Thank you for joining me on the Global Men's Wellness Podcast. I'm Dr. Judson Brandeis. Until next time, stay strong, stay informed, and stay in charge of your health. Take control of your health anytime, anywhere. Visit globalmenswellness.com and start your free trial today. Get expert-level answers in seconds, not weeks, without the cost, the wait, or the awkward conversations. Real support on your terms. Visit globalmenswellness.com now.